Hello, and welcome to Home Hospice Association. All of you are here for reasons that are unique, and we are looking forward to getting to know you. Most of us do not think that our talents have a far-reaching benefit because they seem to be things that come so naturally to us. Those talents, however, can make a project, program, or fundraising experience, one that leads to long-term sustainability and support. We thank you for choosing Home Hospice Association to spend your valuable time with. Let's begin by asking a few questions. What is our vision? To provide end-of-life care to anyone, regardless of age, at any stage of the dying process, in any place or space that will provide safety and comfort to the dying person. We believe in providing quality end-of-life care in a holistic, culturally sensitive manner. We believe in normalizing death through education to professionals, children, families, and communities. We believe in supporting the dying, their loved ones, and those who care for them in grief and bereavement. We believe in a future where we have changed forever end-of-life care. Our mission. Home Hospice Association engages communities to help people die wherever they call home. Compassion, care, and culturally sensitive human connection are the hallmarks of what Home Hospice Association brings to the community. Our commitment. We have chosen to find a solution to a need impacting more Canadians than all other medical or social justice issues combined. 100% of us will die. 60% of us will die from something other than natural causes. No member of our association wants to leave our support. Should we be told by the doctor, there is nothing more we can do, or the support of our loved ones, to chance. Imagine families being able to host a Halloween party in July. Imagine families not having to agonize over who gets to stay because of limiting visitor policies. Imagine respecting someone's dying religious and cultural needs. Imagine not dying in the hospital alone among the commotion of emergency care. Home Hospice Association was founded in 2014 by Tracy Robertson, Jean O'Keel, and Glenn Burkholder when they realized that the terminally ill lacked the resources needed to die on their terms. Western medicine aims to prevent disease and during dying to prevent suffering. Too often, Canadian hospitals and doctors view death and the end-of-life journey as a medical event without a cure. Even if an individual is provided palliative care, it is insensitive to cultural, spiritual, and financial needs. Also, that care doesn't serve the dying and their family through every stage of the end-of-life journey. Home Hospice Association was created to fill this gap. Our unique approach offers services, support, and compassion to those who need it most. We also take steps to support families and ensure they are present and able to grieve without guilt or fear of not fulfilling the dying person's wishes. Let's take a look at some startling statistics. 75% of people living in Canada want to die at home, yet almost 60% die in hospitals. Only 15% of people die at home, and some of those deaths are unexpected. 15% of people living in Canada have early access to palliative care. 47% of palliative care patients in Canadian hospitals waiting to be discharged to residential hospice or at-home support die before they are discharged. 3 out of 5 Canadian primary care physicians do not feel well prepared to help people in need of palliative care. Canadians between the ages of 45 and 74 are more likely to receive palliative care than younger adults and seniors. Is trying to build more hospices the answer? It costs $10 million to build a 10-bed hospice building. In Canada, there are only 88 bricks-and-mortar hospices, most with 10 beds or less. Communities of all sizes are finding it increasingly difficult to fundraise for bricks-and-mortar. Once the bricks-and-mortar hospice is built, community support is an ongoing need to provide the remaining funding the government does not provide. Toronto has only been able to sustain 2 bricks-and-mortar hospice buildings, leaving 20 hospice beds for a population of 2.6 million. How much does it all cost? Acute care hospital bed is approximately $1,100 per day. A palliative care hospital unit bed costs anywhere from $630 to $770 per day. A bed in a bricks and mortar hospice is $460 per day. Hospice at home is under $100 per day. Home Hospice Association solution: free 24-hour support in any place someone calls home, under any roof. Support can begin with the first money raised, no waiting to cut a ribbon. The estimated $10 million raised to build a building funds a minimum of 14,286 days of care in homes. Per person, per day, support costs are variable and can be reduced as Home Hospice Association grows. What is the difference between hospice and palliative care? Palliative care can begin at any stage of an incurable illness and can be provided at any time during treatment for an illness. Hospice comes when there is no cure for an illness and is used during the last phase of life. Hospice is not a building, but a care team that addresses a person's physical, emotional, mental, social, and spiritual needs, improving their quality of life. Hospice care can be done anywhere and under any roof. To quote Cicely Saunders, founder of the first modern hospice, "You matter because of who you are. You matter to the last moment of your life, and we will do all we can, not only to help you die peacefully, but also to live until you die." Community hospice provides more day programs where clients can come in and access programs and care. Residential hospice provides the same service as a community hospice, but provides services in a more home-like environment while providing a maximum of 10 beds. Home hospice provides services and resources under any roof at any time to anyone. Major differences between the hospices: community hospice has 0 beds. Residential hospice, a maximum of 10 beds. Home hospice, unlimited beds for everyone who needs one. Home Hospice Association has important key values that we will uphold and expand as we constantly move forward. Our knowledge, the dissemination of best practices to other emerging communities. Our choice, options make the World Hospice Organization's vision that no one with a life-limiting condition should live and die with unnecessary pain and distress due to lack of access to quality care possible. Our collaboration, as a player in the community, we, in collaboration with any other players in the community, including and especially the caregiver. Our community, attention to cultural sensitivity, small and underserviced areas with challenging demographics, respects all definitions of community. Our empowerment, maintaining that home health service need not be in the business of bricks and mortar. Communities may deliver a non-institutionalized environment where dignity, care, and culturally sensitive human connection are the hallmarks of what Home Hospice Association brings to the community. The majority of the roles within Home Hospice Association are voluntary, which means a lot of selfless people who are passionate about bringing hospice out in the open to educate the public and to give the care and compassion everyone deserves. You are now a part of making a difference in the lives of not only those that are dying, but their families as well. You may participate in more than one area of Home Hospice Association, depending on the time you wish to give to our programs, where your interests and talents lie, and what knowledge and value you can bring to each team. We are a Canadian registered charity, but we still operate the way a business operates, and we have more volunteers than paid staff. We have 2 customers, the person who needs us and the person who funds us. The 3 ways Home Hospice Association mobilizes care: developing agency partnership, develop board membership within communities. This is a process where a chapter is born. A chapter is a board within a community that develops the agency partnerships and recruitment of community volunteers. Recruit community volunteers to assist the agency partnership process, which often includes providing front-line care on behalf of the agency while our partnership is being solidified. Services are free to clients who need it because donors fund our charity. Death cafes are open forum dialogues about death and dying with no agenda otherwise. The aim is to bring strangers together to engage in dialogue about the last great taboo, in hopes that they will extend this dialogue to their friends, families, and communities. Why death cafes? A belief that dying and death are a part of life to avoid until they can no longer be avoided. Home Hospice Association is proud to be a part of the international Death Cafe movement. HHA runs in-person and virtual death cafes to invite conversation, explore concepts of life, dying, and death. Normalizing death is a key mission for this charity. The Candy in Candy Cafe stands for creating awareness and normalizing death for youth. The earlier we talk openly about death and all that it encompasses, the more the society will not treat every death as an emergency. Every day, young people are surrounded by the news of people dying, and they have many questions. It is instinctual for adults to want to protect young people from experiences of death and grief. But given how often they encounter death in their world through novels, movies, video games, the experiences of others, and through personal deaths in their own lives, including pet loss, if we don't answer their questions or listen to their fears, they can feel isolated and be susceptible to misinformation. By having healthy conversations around death, young people will be better prepared to process loss and grief. Candy Cafe is one step in a long journey towards open communication and being comfortable with these natural parts of life. At our virtual Candy Cafe, we will help young people talk about difficult concepts and navigate through challenging questions about dying, death, and grief. Our curated process for integrating with young people and our policies of safe space, inclusion, and respect for diversity make Candy Cafe a program adults and young people can trust. Who are our clients? Our clients are who we provide services to, including adults with a life-limiting illness, children with a life-limiting illness, infants who die in utero or shortly after birth, all those who love them, including their pets. Programs are not meant to be represented by themselves. One person may participate in more than one depending on their program recommendations and needs. Another Day is targeted grief and bereavement support for both the person diagnosed and those who love them, designed to meet the needs of anyone at any time throughout their grief journey. The Bello Project journeys with the pet along the path of their loved one's life-limiting illness to maintain the unshakable bond between pet and pet owner until death occurs. Why is this important? Keeping this companionship together maintains a source of unconditional love that they both need and lessens the worry of what will happen to the pet throughout the owner's illness and after death. Some of the programs under the Bello Project are self-care and peer support for registered veterinary technicians, Paw Castle Studio, which is a community outreach event, and Death Cafe for pet lovers. Programs are not meant to be represented by themselves. One person may participate in more than one depending on their program recommendations and needs. All volunteers take compassionate caregiving as a thank you for all the hard work they do. Whether it's help in the home, help dealing with an endless schedule of medical appointments, or help to always be up, positive, motivated, caring for others is exhausting. Home Hospice Association is there. It seems to be a never-ending series of appointments, treatments, and caregivers flowing in and out of one's home. The illness takes over, it becomes a way of life, it becomes a new identity. Whether it's the person walking the journey of a life-limiting illness or their family, the whole situation is exhausting. Experiential day hospice is a wonderful way to connect with others who may be walking a similar journey. HOP stands for Helping Our Precious Peds. HOP journeys with a family along the path of their child's life-limiting illness to maintain a sense of normalcy as much as possible by providing edutainment experiences as well as all manners of care along the entire illness journey. Why is this important? Regardless of the prognosis, a child's curiosity, desire for accomplishment, and sense of enjoyment remains. Also, ever present is the family's need to share in bonding experiences. Hospice at Home is a 24-hour model of hospice care that includes private professional care, alternative therapies, spiritual and emotional counseling, and death doula support. Pre- and perinatal hospice journeys from start to finish, with parents experiencing the most devastating loss imaginable. Within the pre- and perinatal hospice program is Our Babies, Our Grief Support Group, a 6-week progressive healing group. The goal of Our Babies, Our Grief is to bring parents together, providing the freedom for them to tap into their own wisdom, learning from each other, and explore their grief with freedom and creativity. Our training ties into our programs. There is nothing within HHA's programs and training that is not utilized to the best potential. Offered to all of our volunteers, one of the services provided to ensure our volunteers put their most compassionate foot forward. There are 11 base compassionate caregiving modules, including the art and skill of compassionate communication, changes and challenges along the journey, legacy work, the importance of life review, grief and bereavement, and the importance of self-care on the caregiving journey. There are 2 roles of modules, the role of the Bellow Project caregiver and the role of a peer support caregiver. HHA Death Doula training is a process of online assignments, a weekend training, as well as having to complete a placement where they walk with a client through their death to become certified. HHA Death Doulas take a holistic approach to the end-of-life care, share the desire to support someone's wish to die wherever they call home, in complete control of the decisions they make for their life and death, and they understand dying to be the most natural, organic process. We are a team of professionally trained practitioners ready to offer support in legacy work, planning for days and hours leading up to death, practical needs when we are actively dying, as well as grief support. IPLD training is an extension of our pre- and perinatal program. Infant and Pregnancy Loss Doula, IPLD, certificate program is designed to equip you, professionals, and caregivers with the knowledge, tools, and resources to reflect on the care provided to individuals and families who experience perinatal loss and the grief that follows. The training was created to enhance the holistic end-of-life care provided to patients, clients, and loved ones experiencing infant and pregnancy loss. The Diana Pathway is carrying the legacy of the first client Home Hospice Association supported when seeking MAID. MAID stands for Medical Assistance in Dying. Any certified death doula is able to take this workshop, and they have the opportunity to hear firsthand from a gentleman and a death doula tell the story of their encounter with a MAID death. This workshop was created to build on the knowledge and skills learned in your death doula training. By providing insight into the challenges of working with a client who chooses MAID over a natural death, you will learn how to deliver the special support around legacy, death planning, vigiling, and grief that the death doulas are uniquely qualified to provide. HHA family members and professional associations support one another through a monthly virtual information session. Many Faces of Compassion holds a spotlight on different subjects and challenges around things we may encounter within the community. The sessions help motivate and challenge us to see each other in ourselves, to suffer together, and soothe the physical, mental, or emotional pain. Moonlit Memory Walk, the biggest fundraising event for Home Hospice Association. Each person participating in the Moonlit Memory Walk is walking in celebration that their loved ones lived, if even for minutes, days, or decades. Participants also walk to support the many important programs Home Hospice Association provides. They say it takes a village. Thank you for being a part of our village.